Hi everyone, welcome back to my channel. My name is Rachel. I'm a speech language pathologist and I've been an SLP or speech therapist for almost 20 years. I love mentoring new clinicians and talking to people about what speech pathology is and why you might want to consider becoming a speech pathologist, and then also talking about some of the maybe not so shiny positive things that go along with our field, such like any field. But today, the purpose of this video is to talk about what speech language pathology is, what are the steps to becoming a speech pathologist, and then what happens next. So I'm going to talk a little bit about my career. I've worked in almost every setting and almost in many different states and with all sorts of different ages. So I'll go into a little bit of that and then just talk about the process of becoming an SLP. I will say that there are some things that are maybe not so positive about our field, like I said at the beginning. And I do think that might require another video or another conversation, but these things might come up in the video today. So if they do, and if you have questions about it, feel free to ask. I have my coffee, so I hope you have your beverage of choice, and let's get into it. So when I looked up what is a speech language pathologist on ChatGPT, it said that speech language pathologist can diagnose and treat a variety of speech, language, voice, fluency, swallowing, and cognitive disorders, among other things. And that pretty much sums it up. So we are able to diagnose a variety of conditions. There's some things that we can't diagnose alone, but we can suspect and talk to other professionals about. But that's a big part of our field. That's the pathology word in our field. Some people really do want to get rid of the label of pathology because it can be somewhat negative. I rarely call myself, I would say, a speech language pathologist. It's a mouthful for me, and I feel silly being an SLP, having trouble saying that full term. So I tend to just say speech therapist. Some people get really up in arms about that, and they want that SLP, speech language pathologist term. But to me, most parents see us as speech therapists anyways, and most, members of the public. So I just use that term. But we can work with all of these different conditions in a variety of places. So we could work in the medical setting, we could work in hospitals, inpatient rehab, outpatient rehab, inpatient acute care. We can do head and neck cancer. We can work on voice conditions. We can specialize in like gender affirming voice care. We can work on stuttering and empowering individuals through the verbal diversity lens. We can work with autistic individuals of all ages, depending on what their needs might be. We can work with little ones in early intervention and mainly do a lot of parent coaching and family training. We can do pediatric feeding, which is a lot of sensory motor feeding challenges. We can do adult dysphagia or challenges with swallowing. What am I missing? We can do cognitive disorders. So for like folks who have had strokes or have had traumatic brain injuries, we can work on that. We can do embed AAC or augmentative and alternative communication into our work and work with individuals who have ALS or who have had a stroke and may have lost the ability to verbally communicate through their speech. We can work with little ones who are learning how to communicate, but maybe haven't developed their speech yet, or may never develop it due to some motor conditions. So there's such a variety of things that we can do. And that's what makes our field honestly so exciting, because many people get into this work because they want to help, they want to give back, or they want to have a day that involves problem solving, collaborating with other professionals, and really making a difference in someone's life. And this work is definitely that. It's challenging, but there's a lot of making a difference. I'll say I was watching someone else's video and they mentioned just how meaningful this work is, and it truly is. I remember working in the hospital and I was working with patients who were recovering from brain injury, and I will just never forget. I was a very young clinician. It was one of my first patients, and they were emerging from a comatose state and had not, redeveloped their verbal speech yet. And at the moment when they told their wife that they loved them, I happened to be in the room, and it was incredibly powerful and just very special to be there and be a part of that. And I remember these little moments, throughout my career. So I guess just to say, we can work with a variety of ages, we can work with a variety of medical conditions and medical complications, and in a variety of different settings. So being a speech language pathologist does provide a lot of different options, and it might lead you down a path of specialization. So a lot of people come into this field we're generalists. We learn about all of this in graduate school, or as much as we possibly can in the years that grad school takes, or an undergrad, and then we're set out into the world, and we can kind of take some paths that lead us down to becoming more specialized in one thing or another. I, for example, really like AAC, augmented and alternative communication, and I really like pediatric feeding, and I really like executive functioning. So those are kind of the avenues that I've found myself going over the years, but I could still work with someone, a kid in school working on their S or their R. I could still work with a cognitive patient who's in inpatient rehab or in a skilled nursing facility, or dysphagia. So there's just a lot of options for us. So what does it take to become a speech pathologist? There are years of school, we'll say that. So you have to have a high school diploma, and then you would go to get a bachelor's degree in undergrad, and then you would get your master's degree. So you would get your bachelor's degree, which is typically around 4 years, and then you would get a master's. And typically the master's timeline of school is about 2 years. My program was 2.5 years. So I started in the fall, and then I went through the summer. And in that time, you do take classes. The first year is mainly all classes. And then the second year, you start to have clinical experiences. So I'm trying to remember back, but I believe we started with some classes. We kind of eased into a clinical rotation where we went twice a week. So we would take classes the other 3 days, and then 2 days a week go into our clinicals. And so at the time, I was in a school 2 days a week. So I would go into the community and to the school and shadow and receive some mentoring from the speech pathologist there, and then get some hands-on experience. It is meant to be hands-on, but you are still learning in that phase. The second rotation, I was in a pediatric clinic, like a private practice, and I went there 4 days a week, I believe, and then I had a day of classes. Maybe it was 3 days a week, I can't really remember, but it was like easing in. And then the last rotation, I was there full time. And for that one, I did leave the state I was in. I went to graduate school in South Carolina, and I went down to Florida for my last clinical rotation, which was at a skilled nursing facility, and I was there the full week. So it was a little bit of a whirlwind, but those are the clinical rotations while in school. And then once you graduate, you go into what's called your clinical fellowship year. Currently, if you are studying to become an SLP, there is a year after you graduate that is typically lower pay and typically considered a fellowship. So you are learning, you would have a supervisor, and that's that. And I will add here too, some supervisors are not on site with you all the time. Some are off site and come and check in on you or do like virtual check-ins. I know the school district I was just in here, there was one person who was overseeing a few different clinical fellows. So a couple of them. So just something to think about as you're considering being an SLP. Okay, so if you did not have a bachelor's in communication sciences and disorders, that's typically the path people take. I decided I want to be an SLP, so I'm going to go to undergrad, and that's going to be my major, clinical communication sciences and disorders. And then that would lead you into your master's. That would give you all the prereqs. If you don't have that, some people have backgrounds in linguistics or like psychology or social work or something like that could maybe give them some of the prereqs. You will have to take some prereqs. So I did look up what those are because I can't remember back in the day. But basically, it's anatomy and physiology of the speech and hearing mechanism, intro to audiology, intro to speech and hearing sciences, language development, phonetics, statistics, and then biology, chemistry, physics, and social behavioral sciences. Now, that's what ChatGPT told me. So I don't know, I haven't verified this with the schools that are out there, but just to give you an idea, if you do have a degree that will not give you all of the prereqs, there may be some things that you will have to take. Like I know that there were some people who maybe had a bachelor's in like marketing or a bachelor's in something else, a totally different field. Doesn't mean you can't go to graduate school. There will be things that will transfer, but you may have to take some additional courses. So that might prolong your master's. But once you do have those, and if you do have a background in a related field, then you would go right into graduate school, and if you wanted to, and that would be about 2 years plus the clinical fellowship year. So it looks like a total of 6 to 9 years to be certified as an SLP. As comparison, OTs typically graduate in 6 to 7 years, undergrad and grad school. And then for PTs, so OTs and PTs are now getting their doctorate. Remember that? It's about 7 to 8 years, and their graduate school is about 3 years. So what happens next? So you graduate, and then what? We talked at the beginning that there are so many different things you can do, and I just wanted to lay out my path for everyone and just give you a little example of what my experience was like. So I graduated in 2008, and after I graduated, I did my clinical fellowship at a VA, and it was truly amazing. I think if you want that experience, I would try to go for that experience. I had 2 supervisors. Again, you have to have a supervisor as a CF. And I worked both in inpatient rehab. So it was folks who were staying in a hospital because of some kind of injury, either traumatic brain injury or injury to their body or other related things. And this was from combat, but it was also from like stateside injury. And then I also got experience in acute care, and that was just invaluable. I loved the inpatient rehab side of things. That was much more, it was a lot of cognitive therapy, a lot of executive functioning work. There was some swallowing or dysphagia involved, but the majority of it was getting people back to their prior level of function, or as close to that as possible. They were in rehab, and they were going to be going home or going to outpatient after that. And the acute side, I did a ton of modified barium swallow studies, which are x-rays of swallowing. So we would do that, we would interpret it, and then provide recommendations, work with the radiology techs, which I loved so much. I did a lot of bedside swallow exams. I learned how to work with head and neck cancer patients who had portions of their neck removed and had a prosthetic kind of stopping the hole between their esophagus and their trachea. Now, probably people watching this who might be in that field at this time are like, girl, oh my gosh. But I can't remember the terms of that, but I remember my supervisor was just incredible. I believe she's still there. And she just, we changed out the prosthetic, which was super cool. And I did a lot of cognitive work inpatient and worked with doctors. And it was just so much collaboration. It was fast paced. I worked 4 10s. So I worked, at a 3-day weekend, and those 10 hours went by very fast. So that was what my clinical fellowship was like. Pause. And then the year after that, I got a job at a inpatient rehab hospital, and in Georgia, and I was there for 5 years, and I absolutely I loved it. That's really what I thought I wanted. That's all I thought I wanted to do, was work with adults who are recovering from brain injury or spinal cord injury. You work so closely with family members and caregivers. You work the team aspect there. So it was a very collaborative environment. We would co-treat often. So PTs, OTs, the neuropsychologist, the doctors were always on the floor. The nursing staff were incredible. And it was a lot of team meetings, was a lot of reporting on the progress of each of our patients. We had a group of patients that we saw on each team, and we did it all. There was nothing that we would say, oh, I don't do that. I'm a speech therapist. I don't do that. We helped patients with their morning routine, their shower, because there's a lot of cognitive things that go into that and communication. It was just wonderful. It was wonderful. And then I decided that, I needed to maybe see other parts of the country, and I decided to do travel therapy. So I left that job, and I got a contract with a company that would place me in various states and locations, find me a job, and I would go and live there and do the work. And so I went out to California, and I was in the Santa Clara area, and that was the first foray I'd had outside of graduate school working in a school. And I worked at a school there, and then I moved to Southern Oregon and had a rotation at another school, and then I moved to Portland, Oregon, and got a job in a school and stayed there for quite a few years. I stayed there for about 5 years, working in a school. And you know, with school, we can talk more about this if you guys have questions, but with school contracts, you typically manage a caseload of students. You case manage if they have speech and language impairment, and then you provide services if maybe they have another eligibility like other health impairment, or maybe they have autism, and you're providing those services in that IEP. And I was in that school. I had a pretty high caseload. I had almost 80 students, which was really high at the time. There was another person who came one day a week to help me out, but it was a pretty high caseload. And there was a pretty complex class also that was associated with that school. So it was a lot of students with intellectual disability who were served partly in that classroom and partly in the gen ed curriculum. So I did that for 4 years. And then we moved to a different state. We moved to Nevada. And while there, I helped open a rehab hospital that was like just starting out, kind of developed the speech program there for a little while. And then I worked in early intervention. So with little ones who were showing a speech or language delay and supporting the family. That is a lot of coaching to the parent, a lot of education provided, and a lot of play-based therapy, which I ended up loving so much. And I got a lot of experience with AAC. I had some experience doing in the inpatient rehab hospital, but also with the littles. And then during that time, I decided I wanted to do this on my own. So I opened my own practice and worked with a variety of different clients. I had all different ages, but it was a lot of individuals who were autistic and supporting them and their families, a lot of pediatric feeding. And, throughout all this time, like you're hearing me talk about, I worked with adults, I worked in a hospital, I worked in a school, I'm doing private practice. I had to keep learning. So that's something else to consider. I described the schooling. 7 years seems like a lot, but there's just so much that you can know in our field that it's impossible to get it all in those 7 years. When I was in school, I didn't have an AAC class. I learned nothing about augmentative and alternative communication, nothing. We didn't learn anything about pediatric feeding. Everything that I learned was geared towards the adult. So I had to take many courses additionally out of my own pocket, paying to learn more about sensory motor feeding for babies and toddlers and younger children. So it's a lot of continuing education, but I'll say that's required. It's required as part of our licensure at the state level and with ASHA with your C's. So, learning is ongoing. Don't expect to get in this field and then be like, that's it. I don't have anything else to learn. You will always have stuff to learn, and there will always be classes and courses. Maybe that's good or bad. I don't love paying for these things myself, but it does. Some of them are so incredible, and they do give you a leg up, and they build your confidence and they build your skill set. So very important. And then anyways, I moved back here. We moved back to Oregon, and I got a job as an AAC specialist or AAC consultant with the school district, which has been very fun, very interesting, something that I thought I would always want to do, more consultative work. And I did enjoy it a lot, but I really miss working directly with clients. So I'm back I opened my private practice again, and I'm working on getting more clients. So it's been like this big circle, but I think I really encourage you to think about this as an opportunity that is honestly endless, an opportunity that is very open-ended. And our field honestly needs people who are passionate. It needs people who are diverse. You know, one thing I'll say, this could be in another video too, but our field is very white. It is very white woman, like lots of white women. I'm a white woman, but it is a lot of white women. And we need people who are multilingual. We need people of diverse backgrounds. That's what our field really needs. We need more Black and brown therapists. Honestly, we need more men. So there are a few men that are interested in this field and are out there practicing, and they're killing it because we treat a lot of men, we treat a lot of boys. And, you know, having someone who looks like you in your therapy as your therapist is so impactful. So, you know, if you're thinking about this and you're just like, I'm not really sure, maybe I'm too old, or I don't know anything about this, or, you know, there's a program that's far away. There's all sorts of things that you can look up online. There's online programs. You can take your time. You can do it part-time. That might extend the time that you're in school, but it might allow you to spread your learning out while you're still working. But I would say our field needs you. Our field needs reform, maybe, and we need fresh perspectives, and we need people who are creative and who are passionate. And yeah, it's a really wonderful career. Again, like I said, there are some negatives, and you know, as a like preview, maybe I would say pay could be a negative. Some of the restrictions that we have through billing, maybe the diversity level in our field, that's another potential, that's another negative. So thinking about all of these things as you're considering being a speech pathologist. So I hope that this was helpful for you. And if you have any questions, leave them below. But it's a really rewarding career, and I encourage you to check it out. So enjoy your beautiful day, and I'll see you back for another video. Cheers.